All right, good morning. I'm Dr. Tom Farley. I'm Philadelphia's Health Commissioner. I want to thank you very much for coming this morning. By today, you've probably heard the terrible statistics that in 2017 we had approximately 1,200 people in Philadelphia who died of a drug overdose. That's a sharp increase from previous years, and there are three factors that are contributing to that increase. First, for many years, doctors have been prescribing too many prescription painkillers to too many patients in doses that are too high. Second, Philadelphia has the cheapest and purest heroin of any major city in America. And third, in the last couple of years, street corner drug dealers have been selling fentanyl, an opioid that is particularly potent and addictive and deadly. Now, there are many steps needed to combat this crisis, including getting doctors to prescribe these opioids less, encouraging and assisting people who are addicted to get into treatment, and making the antidote naloxone more widely available and more used. So we're here today to talk about one piece of that last step, to encourage everyone who uses opioids or everyone who is in contact with those who use, and that's almost everyone in Philadelphia, to obtain and carry naloxone and be quick to use it. First, a little background. What are opioids? Opioids are chemicals that cause suppression of breathing. They lower the brain's reminder for you to breathe. That includes opioid pills, such as Percocet and Vicodin, and especially OxyContin, and it also includes heroin and fentanyl. If someone takes a big enough dose of any of those opioids, they stop breathing and they die from lack of oxygen. What is naloxone? Naloxone is the antidote to this. It is a drug that blocks the effect of opioids on the brain. That works for all opioids, including heroin, including fentanyl, including those pills. If someone takes enough opioids that they become unconscious and they stop breathing, and then they're given naloxone, then they wake up and start breathing again. And this happens in a matter of seconds. It is very effective. Now, naloxone itself is completely safe. If someone is not taking opioids, they have no reaction whatsoever to the naloxone. So that means that the naloxone in Philadelphia has the potential to save hundreds of lives each year. Now, Philadelphia's first responders, we have some here today, have done an excellent job of treating people who have had an overdose. In 2017 alone, our emergency medical services alone revived 6,000 people with naloxone. But it can take 10 minutes or more for an EMS crew or a police crew to arrive in response to a 911 call. And if someone stops breathing, they may die in less than 10 minutes. So we need help from people who are already there to treat overdoses so they don't become fatalities. Now, studies suggest that half or more of overdoses have someone present at the time, a witness. They're typically friends or family members. So we need those friends and family members to carry naloxone and be quick to use it to save a life. Now, I think the most important thing and the most rewarding thing that any of us can ever do is to save a life of another human being. Today, anyone in Philadelphia can become a hero by saving a life. It's not hard. So the message is, saving a life can be this easy: carry naloxone. And you see what the billboards look like there. The picture shows exactly how to do it and how easy it really is. You just spray naloxone into the nose of someone who's had an overdose. Now, these billboards you're seeing here, or these posters that you see here, are going to be on billboards, and they're going to be distributed on social media for the next few months here in Philadelphia, from March until June. And for those of you here in the press, you particularly can play a really key role here by furthering this message. You can help us save those lives. Now, in a minute, I'm going to demonstrate exactly how to use naloxone, but before we do that, we have a few other people here who want to talk about their experience and their expertise with using naloxone. So first, I want to introduce Crystal Yates, who's the Assistant Deputy Commissioner for Emergency Medical Services at the Fire Department. Now, the Fire Department's EMS division serves on the front lines of the opioid epidemic. All the city's fire engines, their ladders, trucks, and their ambulances carry and administer naloxone. And Deputy Commissioner Yates has had 20 years of service with the Philadelphia Fire Department.
Good morning. I am Assistant Deputy Commissioner Crystal Yates. I work for the Philadelphia Fire Department EMS Division. And the message is, naloxone saves lives. It truly does. The fire department's paramedics, EMTs, our first responder partners in public safety administered naloxone last year over 6,000 times. We're on the front lines of the opioid epidemic. All of our fire engines, all of our ladder trucks, and all of our ambulances carry and administer naloxone to the public. The city has also responded by providing naloxone to other partners, including the police department, the Department of Prisons, some of our community partners such as Prevention Point, the library system, SEPTA, and others. Naloxone is safe, it's easy to use, and it's effective. Carrying naloxone can be just as important as learning CPR. It can truly save a life of your loved one or even your own life. We are recommending that if you use opioids or if you have a loved one or anyone you're connected to uses opioids, please carry naloxone. Just as Dr. Farley said, it may take us some time to get there. You can save a life. We always ask people to start CPR when somebody has had a cardiac event. It's nice to know that we have partners out there that will administer naloxone when we have an opioid overdose. We know that overdoses truly kill people. We know that we have a problem. Carrying naloxone as part of our partnership can help. Additional solutions involve connection to treatment and prevention. The challenge for first responders is that sometimes people don't want to go to the hospital. The fire department is working on a multidisciplinary unit to address that. We would like to make it more possible for people who refuse to go to the hospital to receive connection to care. The city, the health department, and Department of Behavioral Health specifically are also working on preventive efforts. So I will repeat, please, naloxone saves lives. If you are connected to someone who uses opioids, carrying naloxone can be as important as CPR. Thank you.
Now I want to introduce Destiny Campanella. Destiny is an advocate for mental health and substance use treatment and harm reduction. She volunteers her personal time for those actively living with substance use and experiencing homelessness.
Good morning. So I was born and raised in South Philadelphia, where I currently reside. And I'm a person that I've had substance use disorder affect my life in multiple ways with many different outcomes. I'm an adult advocate and outreach coordinator for mental health partnerships where it is mandatory for all staff to be trained in overdose prevention. We've had 5 overdose reversals this year that I know of. Okay, so some of my naloxone experiences that every Friday mornings I go out to the homeless encampments in Kensington underneath the bridge. They're people that they might not be ready to stop using, or they're having barriers into getting into treatment. So in my opinion, it is most important that that population has access to naloxone. So I take advantage of that standing order, and I give it out like water to them. I also give it to my family members. If their children or their significant other is actively using, or even if they just come home from treatment, or even if they're in recovery, I make sure I give it to them and I teach them how to use them. So the population that is the highest risk of an overdose, I just briefly touched on. So actively using, friends and family who are actively using, make sure they have access to it. Individuals just coming home from treatment, so whoever they may be living with, you might want to make sure they have it. And of course, those in recovery. Thank you.
Thank you. I now want to introduce Evan Figueroa Vargas. He is an advocate and family member of someone who has lost a brother to opioids. And he's a person in long-term recovery himself, and he's a peer-to-peer homeless services provider, and he knows about using naloxone. Evan?
Good morning, everyone. As Commissioner Farley said, I am a person in recovery, also a family member, who's someone who unfortunately has passed away as a result of opioid epidemic. In the middle of November, I was trained and provided naloxone through my work at Mental Health Partnerships, which is based in Center City, Philadelphia. My understanding at the time when I received my training in naloxone was that I will be using this naloxone in training for my work with homeless services in the city of Philadelphia. However, I decided to carry the naloxone on my person and in my car outside of work hours, and that turned out to be a very wise choice. In the beginning of December, which is only weeks after I was provided the naloxone, I was driving home from work, and I encountered a male unresponsive on the ground, and I pulled over, worked with some bystanders to contact 911 and get him some emergency medical attention. However, while I waited, I administered one dose through the nasal cavity of naloxone. This person went from shallow breathing, turning purple, to very responsive and back on his feet within like 4 to 6 minutes. So by the time the EMS got there, this guy was back on his feet. He was alert, and he gets to live to fight another day to be able to overcome his addiction. I encourage and plead with all Philadelphians to carry naloxone, because the first step to recovery and the first step to to overcoming the opioid epidemic, the number one thing you need to do is stay alive. If you're dead, you can't overcome your addiction to opiates. So I encourage all Philadelphians to carry naloxone. Thank you.
Thank you. That story is a story that we want to have repeated hundreds of times across the city of Philadelphia. We certainly have the opportunity to save hundreds of lives if everyone who is in contact with people who use opioids carries naloxone and is quick to use it. I want to, in a minute, demonstrate how to use naloxone. First, I want to recognize a couple of other people here in the room who you may want to ask questions of afterwards. We have Chief Nessel from the SEPTA Police. The SEPTA Police carries naloxone and has saved in a lot of people in recent years. I don't have the exact numbers, but they may have them. And also have Elvis Rosado here from Prevention Point, who himself, he just told me before we started, has revived 42 people over the years because of his role there. So now I want to just do a quick demonstration on how to use this. First, naloxone comes in multiple formulations, but Narcan, the one that is most widely known, looks like this. It is it's got a little liquid in it, and if you press it like that, it sprays, and that's what gets in the nose of someone and can save them from an overdose. So, and it comes in a box like this. All right. So here's a demonstration. If you come upon someone who is unconscious on the ground and you think may have an overdose, there are 3 simple steps you need to do. First is you check to see if that appears to be the case that they're having an overdose by seeing if they respond to shouting to them or touching to them. So, Tom, how are you doing? What's the matter? Okay, get no response. Then you take the naloxone and you spray it in the nose. If this works, it's going to work in a matter of seconds. If the person does not respond in a matter of 2 to 3 minutes, you can repeat the dose. After you give the first dose, call 911, because whether this person is revived or not, you're going to need to have the expertise of the EMS crews to help this person out. It's as simple as that. Now, I want to make a few other points. Again, now I just did what needs to be done. I want to emphasize again how easy that was, and the slogan, saving a life can be this easy. So a few other things that people need to know. Anyone can buy naloxone at a pharmacy in Philadelphia under a standing order written by Pennsylvania's Physician General. You don't need a prescription. You should ask the pharmacist for naloxone, If he doesn't have it, you can ask, what pharmacy is stocking that you can go to? If you are on Medicaid, you can buy naloxone for no copay. Medicaid will cover the full cost. If you're not on Medicaid, you may have a copay, or you may ask for a different formulation that doesn't have a copay. There are different spray devices made by different companies. They come under different trade names. This is the one we just demonstrated that goes by the trade name of Narcan. This is a more generic version that may come under the trade name Invisio. Okay? There's more information on all of this at phillinaloxone.com. That's why we have on the ad phillinaloxone.com. There you can get information on where you can get a hold of naloxone. And if you want more training, there's an online training at phillinaloxone.com. Or if you're not that comfortable with this without an in-person training, you can go to an in-person training, and there's a calendar of in-person trainings at phillinaloxone.com. They're offered by the Health Department, they're offered by the Department of Behavioral Health and Intellectual Disability Services, and they're offered by Prevention Point. So just go to phillinaloxone.com and see what trainings are available and sign up. And all of this is free of charge. All right, so again, saving a life can be this easy. Go to phillinaloxone.com, and we're here, all of us, to answer any of your questions. All right, if there are no questions, oh, you got a question, yes. I don't know the answer to that question. That is just data that's available from the DEA. This is, I think, a major shipment point for heroin and other opioids into this country. But beyond that, I don't know the answer to that. And it's been the case for some time. All right, yes? It's going to run from March to June. These will be on billboards, and they'll be distributed through social media. Yeah, my response to that is this. If you're driving in a car that has a lot of nice safety features and you're wearing your seatbelt, does that make you drive more recklessly? I don't think so. No, I don't believe so. So we don't think so. We think that having this widely available is going to save a lot of lives. No one who is using drugs wants to die of an overdose, okay? They're using drugs because they're addicted, because they have no choice, and this is going to save their lives. So we don't think that this is going to increase risk-taking. Again, if you're on Medicaid, it is no cost to the consumer. And some others, there may be a copay, and that copay may vary. I don't know what the different amounts are. You do not need a prescription. You go to the pharmacy desk in the drugstore and request it of the pharmacist. Okay. Thank you very much for coming here today. I really appreciate your getting the word out, because this is an opportunity to save lives. All the people we just mentioned will be here if you want to have individual interviews afterwards. Thanks again.